The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Welcome to Project Independence and You on Community Talk Radio, 88.1 FM and WCWP.org. I am your host, Rebecca Miller, and our co-host today, of course, is Otto Los. Hi, Otto.
Hi, Rebecca.
Good morning. Good morning. Good morning. We're going to be talking today with Taryn. I'm going to pronounce this hopefully right, Kutujian, and also Osman Canales, both of whom are from the Alzheimer's Association. So thank you so much for joining us today. And I know it's going to be a great informative show. And I think maybe we should just get right to it. I know that we have a lot of questions. A lot of people have questions. And I think one of the things that I always, when talking on the radio, I like to clear up is that when people have kind of memory loss or dementia, they're in fear of Alzheimer's. So it's kind of, Alzheimer's is a condition from out of dementia. So dementia, it could be a lot of different things. So I was wondering if you could kind of elaborate on the difference between dementia and Alzheimer's and whatever information to provide with that.
Absolutely. Thank you so much for the invitation to be on your show today. We are very happy to be here with you. And hello to all the listeners. Thank you again for tuning in for today. So what is Alzheimer's disease, right? Alzheimer's is really a type of dementia, like you already mentioned, that affects memory, thinking, and behavior. So some symptoms eventually grow severe enough to interfere with daily tasks, right? So again, Alzheimer's is a form of dementia, but there are many other forms of dementia. There is, for example, dementia with Lewy bodies, vascular dementia. So there are many, many other forms of dementia. So dementia is the umbrella term to describe all these diseases. Alzheimer's, it is the most common form of dementia, accounting for 60 to 80% of all the cases. And something that's very important for audience to know is that Alzheimer's is not a normal part of the aging process. It is a progressive disease, meaning that it gets worse over time. And as of now, there's really no cure for the disease.
So there are people that might be listening or, make the assumption that, maybe their parent or someone they know it has Alzheimer's. Although, like you were saying, there's many forms of dementia, including Alzheimer's. So are there symptoms different from Alzheimer's than Lewy body or some of the other forms of dementia?
Absolutely. So there are a lot of common signs that we actually give a lot of really great free educational programs on, whether virtually or in person, to kind of hit on exactly what you're just talking about. How do we make sense of what are typical signs of aging, and how do we know, where there could be potentially Alzheimer's or another type of dementia or even something else present. Mm-hmm. So some of the symptoms that we talk about in really depth, and the main thing here is we're looking for patterns. So things like memory loss that disrupts daily life, something, like all of us have, let's say, forgotten, what day of the week is it? What month is it? Oh, wait a minute, what day, where am I? But when you kind of remember, when you start to think of that as repeatedly having those patterns of forgetting those types of information or forgetting details that would normally be very important to you. So we really break out, what could be a typical sign of aging versus something that's indicative of something like Alzheimer's or another type of dementia. Things like challenges in planning or solving problems. So again, if you have a momentary issue with solving a problem, or maybe you might have forgotten to pay a bill that month, or maybe have forgotten to get a haircut, something that's a momentary lapse or a momentary forgetfulness. Because if you think about so many of the things that we're dealing with as people, whether it's the pandemic, our financial situations, our healthcare, our families, there's many, many things that could cause or be reasons why we could forget things momentarily. But things where we have patterns of things over time, things with difficulty completing familiar tasks over time. We have difficulty with this, confusion with time or place. So again, momentary things are attributed to typical signs of aging. But when you have this more of a pattern, more of a repeated confusion with time or place, or you start to really become upset or agitated when you're trying to grasp these details in your mind and you can't really find them, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing. So we have people who talk about being journalists or being avid readers, and then all of a sudden losing grasps with words or not being able to command those words when they're starting to speak and articulate, misplacing things and the ability to find where they are and retrace those steps. So again, here, a typical sign of aging is, let's say maybe you forgot where you put your keys, but then remembering where they are. This really a pattern of Alzheimer's disease or another type of dementia is really where you can't recall that and you're having trouble over time with those things. Also, other signs and symptoms can include decreased or poor judgment, withdrawal from social activities, or changes in mood and personality.
This is an easy topic to talk about when we're talking about it on the radio as a non-related to a person situation.
Sure.
If you have to, let's say you see people within your family who show a lot of these signs, it's not an easy topic to bring up or talk to anybody about. Any thoughts on how do you flow right from the beginning? I think the end stages are pretty clear. Somebody has a big problem, it's obvious. But the early part of this whole process, as I have seen in some cases, is not easy to handle. When you go to a doctor, the doctor, your own primary doctor, for example, may say, yeah, okay, I asked you 3 questions, you got them right, but you or somebody else knows that this family member has more of a problem than those 3 questions. So I guess my question really comes down to, how do you go about handling this whole thing right from the beginning? When you suspect that there's a problem, how do you go about addressing that with somebody? And what do you do? Do you bypass your primary doctor and go to a neurologist or whoever you have to go to? I'm very interested in that part of it. I think that's the tough part.
Yes, so having the conversation with someone that shows some of these signs that Taryn mentioned, it is definitely a difficult conversation to have, right? You definitely, and we do provide also educational programs on how to have a conversation with someone showing these signs. So the first thing that you want to do is you don't want to ignore the signs. You want to take note of what you are seeing, what are those changes in the individual. So make note of anything that you see different in that individual. You want to also take note after when it tends to happen, right? When that behavior tends to happen, around who is in the house or outside the house. So you want to take note of all of that and prepare to have the conversation. You may want to write some sort of a script because you definitely want to be mindful on the way you approach this topic with the person. You don't want to, approach the person in a way that they will feel threatened or ambushed. So you want to use I statements. You want to go to the person in a way to that you want to support them. So for example, you can say statements like, the other day I saw that you got lost getting home from the supermarket, and that really worried me. Has anything else like that happened to you another time? How have you been feeling lately? You haven't seemed like yourself. Is everything okay? So definitely you do not want to use the term dementia or Alzheimer's, because right away that will trigger resistance. That will make the person uncomfortable and will make the person not want to listen to you. So again, you want to go to the person in a supportive way, and you want to let the person know that you'll be there throughout this process to support the person. You want to use tactics like, let's go to the doctor to get you checked up and see what exactly is happening. Because there are many other things that could be causing those behaviors or those changes. It could be, high blood pressure. It could be interaction between medications. It could be stress. So there's many other things that could be causing those changes as well, that it may not be Alzheimer's or another dementia. So definitely you want to have the conversation right away. You want to also ask people around the person, family and friends, what other changes they have noticed in this person, right? And discuss among family as to who is the appropriate person to have the conversation with that individual. Maybe the individual is more relaxed and comfortable in the mornings. So you want to have the conversation when they are comfortable and relaxed. Maybe the individual is more relaxed when they are out of their home at a coffee shop. So you want to use that opportunity and bring them to a coffee shop and have the conversation. You may need to also have multiple conversations. Maybe the first time that conversation didn't go as planned. So you don't want to give up. You want to take note of what went wrong and try to improve the conversation, but continue insisting to have the conversation. And then the second part of this question is how to get the person to the doctor, right? Because that also is the resistance that individuals may not want to go to the doctor no matter what you tell them. So there are different strategies to address that. The first one is that if the individual has Medicare covers the annual wellness visit. So you can say, it is time for your annual wellness visit. We have to schedule an appointment with your doctor. And the annual wellness visit that is covered by Medicare covers also cognitive assessment in that test, right? So you want to use that opportunity as well. Or you can say, we need a prescription refill, right? For your medication. So the doctor says that you need to come in to see him or her in order to give us a new prescription. So that's another way to get the person to see the doctor. And then the last part of your question about, the doctors, the primary care physicians sometimes saying, oh, everything is fine. These are just normal age-related changes and everything is okay. If that's the case, you definitely want to be an advocate for your loved one. You need to be an advocate for your loved one. And if you feel like that you are not getting the response or the doctor is not addressing the situation correctly, you have the right to advocate and to also seek other doctors' help as well.
Osman, those were all great ideas. It's a difficult topic, and frankly, nobody wants the idea that they might have some form of dementia. I think that's low on everybody's wish list. Mm-hmm. So it's tricky at best. But the last part about getting to a doctor and the primary doctor, let's say you're the person who's with the person, and now you have to address this in front of the person with the primary doctor. There's nothing easy about this. That's the bottom line. There's no cookie cutter way that's going to work, I think is what I'm hearing. But the words I think that you said that are critical are supportive, family, who will best be to communicate about things like that. There's always somebody in the family who can break the barrier easier. It's more accepted. So I think it's all great stuff. So now we were at the point where somebody says, yes, I do have some problems. I'm not sure what they are or whatever. What do you do now? Do you go? Are there tests available, or how do you go to the next level where now it's been identified? Yes, there's a problem. I or whoever has a problem, and now what? What do I do now? We go to the doctor, and maybe the primary doctor. My opinion is most primary doctors are not going to get in too deep into this topic. That's an opinion, just based on witnessing things. So you have to go beyond that, in my opinion. So now, where do we go now? What's the next?
Yes, definitely. So most people address memory concerns with their primary care physician, like you already mentioned, and their primary care physician refers them to a specialist for further testing. And there are different testings that are available, right? There is and there is no a specific one, right? So different specialists may use different tests, right? But some of the assessments may include interviews with family members. It will interview the history of the person. Will take note of the history of the person, and may also do laboratory tests and some of those PET scans tests as well, right, to determine what is causing those changes in the individual. And again, a diagnosis of, it's very, very important. And having the diagnosis early on is also very, very critical. So early diagnosis is an important part of this process. So the sooner that you address these memory concerns with the individual and you get the individual to the doctor for assessment, the better it is. Because as we know, this is a progressive disease, which means that it will get worse. The individual will get to a time where they will not be able to make decisions on their own, and someone else in the family will have to make decisions.
Okay, thank you so much. We actually have to go to a quick break, but we'll pick up where you left off. You're listening to Project Independence in You on 88.1 FM and WCWP.org, and we'll be right back.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to WCWP.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. Those little button things on your phone screen. Just ask your grandkids.
Welcome back to Project Independence in You on Community Talk Radio, 88.1 FM and WCWP.org. I am your host, Rebecca Miller, and our co-host today is Otto Los. We're talking with Taryn Kutujian and Osman Canales, and they're giving us a lot of information concerning the Alzheimer's Association. And before break, Otto, was really working on a 4 or 5 point question, and a lot of great response from you all, a lot of information. I wasn't sure if you were finished with your complete statement before we went to break. Osman, if you needed to add anything additional.
Yes, I just wanted to go over some of the list of specialists that may be able to diagnose someone with dementia or Alzheimer's. So they are geriatricians who have additional training in medical care for diseases and conditions common among older adults, generally over age 65. And there are other neurologists who specialize in diseases of the brain and the nervous system. And it is important to note that not all neurologists specialize in Alzheimer's and other dementias as well. And other specialists include neuropsychologists, who can assess and diagnose and treat psychological disorders associated with brain-based conditions, psychiatrists who specialize in disorders that affect mood or the way the mind works. And lastly, there are also psychologists with special training in testing memory and other mental functions. So this is a list of different specialists that a person may see to get an accurate diagnosis.
Osman, is this information on your website?
Absolutely, yes. Our website has a wealth of information from treatments that are approved by the FDA to address some of the symptoms, to the list of these specialists that I provided now, and also information on how to have the conversation with the person. We have a wealth of information, and we have great tools on our website as well for caregivers. We have a session specifically for caregivers that provides tips and strategies and recommendations. And we also have a session for individuals with the disease. So our main website, it's alz.org. Again, that is alz.org.
Thank you. Is there a definitive test for Alzheimer's, or is it more of like ruling out or ruling in symptoms, compared to other forms of dementia? Like, can you say this is absolutely 100% Alzheimer's based on these diagnostic tests?
So the testing, so again, there are no one test, right, for the diagnosis. The specialists may use different testing and assessments. And to answer your question, now we have, all these testings that give a high percentage accuracy of the diagnosis. I'm not going to say things, may change or happen, and you may want to go for a second opinion, right? But the testing available now, it does provide a high certainty of accuracy for the diagnosis.
Yeah.
This is also really, I think, why it's even more, to speak to Osman's point, the importance of early detection is crucial. For many of the things that Otto had just, described, where it's not easy to have these conversations, that maybe we all know that something is happening, or that person knows that there are changes, and they may be worried, afraid, confused, nervous about going down that path of finding out the answers. And it could be something like Osman said, it could be something related to glaucoma or diabetes or blood pressure, or something that has nothing to do with Alzheimer's or dementia. So it's even more important. And even if it is related to Alzheimer's or a type of dementia, so important that we can get that early detection, because it will enable us to not only create a great plan for that person, because like you've said, Osman, and like we're talking about now, Alzheimer's disease and other types of dementia, even if it affects 10 people, each of those 10 people are going to have very specific experiences, and it's going to affect them differently. So the importance of that early detection will not only help us create those customized plans for that person and their family, but to help them be involved in the process. We're all adults, and all of us listening right now, think about, do you want to be told no? Do you want to be told what to do? Do you want to be questioned, about your life, about your hygiene, about your choices for food and clothing and where you go and your activities? These are not easy things to talk about, Otto, as you said. So it's even more important to start to have these building block conversations with loved ones, with concerned people, even if it's little things that could be attributed to something else. It's so important that the people around this person show their love and support by taking notice and recognizing even the smallest indication that there could be a change or something amiss.
Taryn, could you go a little deeper into the create a plan? What does create a plan mean? What's this plan going to be made up of?
Absolutely. So going back to our website, alz.org, it has an amazing wealth of resources on it, all of which are free, and one of which is called Alzheimer's Navigator. So Alzheimer's Navigator is a tool that anyone can use at any time, on any device, anywhere they are, 3:00 in the morning, right now, a holiday, whenever it is. For specific information about creating a plan for yourself or a plan if you're a caregiver for the person in your life. The Alzheimer's Navigator will help you create a plan at any stage of your trajectory, whether you are just beginning right now to get building block information, get a workshop, get some information. If you haven't yet gone to the doctor, creating a plan to do that. If you're someone who's a caregiver, helping with those conversational pieces, like Osman had mentioned, on how to initiate those conversations and have multiple conversations if need be. If you're at the point where going to the doctor is something that you or that person are ready to do together, the Alzheimer's Navigator can help you create plans there. As Osman has mentioned, going beyond the primary care provider with gerontologists, psychologists, nutritionists, and the like, the Alzheimer's Navigator can really make a lot of this information, which would for any of us be overwhelming and difficult to navigate and get through, make it very easy, step by step. And what's more important is specifically tailored to you. So if myself as Taryn, if I went on and created my plan, and you as Otto went and created your plan, Otto, your plan is going to be very different and specifically geared towards not only your specific needs, but things about you and your life, where you live, who is in your family, who is accessible to you and your family. Do you have transportation? Are you on any medications? And there's a lot of other types of information that, again, is part of that navigation process, and it goes into those plans. And plans can be created at many times. So it's not just like a one and done, you go on one time and you have a plan. And because many things can happen, your diagnosis can change, the medication can change. You may have a symptom that started out mild and now is more severe, or the opposite. You may have an additional symptom that you didn't know to expect. So the Alzheimer's Navigator on our website, alz.org, is an excellent resource and one of many to help anyone at any stage start to begin those building blocks of how to do step one, step two, all the way through, every stage of their diagnosis and everything in between.
Taryn,
Sounds
we
like
have, I'm sorry,
our
do we have
circle.
a number of people on this show who listen who do not have computers, believe it or not. Is
Okay.
there a phone number
Yes.
that they can somehow take available, make use of the things you just described?
Yes, thank you for that question. And you're right. There are many people who don't have computers, who don't have access to the internet, right? So how do we reach those people? We have an amazing 24/7 helpline, 800-272-3900. Once again, that's a 24/7 helpline. It's 800-272-3900. This is available in over 200 languages. You can get help with anything from any of the things that we're talking about right now to I'm a caregiver. How do I begin having this conversation with the person I love? To I'm a person that's noticing changes in myself. I have questions about what's going on with me, to everything in between, to, support groups, resources on the newest medications and research around Alzheimer's and other types of dementia. And the most beautiful thing about this helpline is you can call us anytime. So if you're a caregiver struggling at 2-3 o'clock in the morning with something or someone that has an issue and you're not sure what to do, and maybe it's safety related, or maybe it's not, maybe you're just confused and you're not sure what to do, you can always call our helpline and you will be connected with a master's level clinician who will help you guide through that process, whether it's a safety issue, whether there needs to be a plan in place, whether it's something that is immediate and more of an urgent need, like a person is waking up at 3 o'clock in the morning, wanting to get dressed, wanting to go to work. And maybe a caregiver is on the helpline saying, how do I help my dad understand that they're not going to work today? And, how do I do this safely and in a way that's not going to upset him and trigger, other parts of the Alzheimer's disease and types of dementia? So there are amazing resources that we can offer on our helpline. It's always available. It's always free. And just like I said, 3 o'clock in the morning, holidays, evening, weekends, it's always available. And what's even better about it is if you're on this call, if you're listening right now and you're, let's say, thinking about somebody in Florida, or you're thinking about somebody in Alabama or Texas or Ohio, the helpline can connect not only you to resources that can help you with your concerns in New York, but can help them with whatever resources and concerns that they need in their state. That's the beautiful thing about the Alzheimer's Association, is we're a national organization and we're connected all across the country.
Great stuff.
It's, again, going back to Otto's original multi-part question, which I really loved, and you guys answered so well. I don't know if I missed it or not, but do you provide kind of, I mean, it almost sounds like the initial conversation with someone, you know, it's like an intervention, almost like a minor intervention, you know, especially if the signs aren't really progressed yet, but you're just starting to notice. So it's at that point. Do you have like I don't want to say a package, but like a way for people to address the loved one that's showing signs with options? I mean, when you do an intervention, you can't just say to somebody, you know, hey, you know, I'm noticing this, let's go to the doctor. It's, you know, here are the things we can do, you know, and like it could be even, you know, like you were saying, it could be like a medicine type of conflict going on. So it could be anything going on. So is there like, it's almost like we would need help to talk to a loved one, but we want to provide them options too. You know, it's not just maybe going to the doctor, because like Otto was saying too, and I kind of agree, because I know a situation. The primary doctor knows the patient, and you know, they may think that the senior's even depressed, which a lot of times I've heard. Oh, well, you know, it doesn't seem like it's dementia. It's perhaps they're depressed and need to take medication or whatever the reason. But, you know, if I'm going to go to somebody and give them, you know, say, you know, I've been noticing this, I want to make sure I know we could do this or we could do that. You know, do you kind of have, I don't want to say a script or, you know, just some kind of way to handle this in, you know, optimally?
Yeah, so we have the roadmap to approach Alzheimer's or dementia concerns that guides the individual on how to, you know, have the conversation and prepare to see a doctor. That is also available on our website. Those are 10 helpful steps that an individual can take, and include some of, you know, some important questions that the caregiver should ask prior to having that conversation with the person, right? And prepare to see a doctor. It helps also with preparing to see a doctor. Like, what should I bring? What questions should I ask my doctor? What are some options, like you say, that they are available? All of those questions are addressed on this plan that we have on our website, on that roadmap that we have. It is free. People can download it to their computer, print it, and share it with anyone in their families. But then also our 24/7 helpline is there available. And what they can do is that they'll, you know, ask several questions to whoever is calling. The caregiver in this case is calling because they notice changes in their loved one and they don't know what to do and they don't know what options are available. They'll call a 24/7 helpline. And our 24/7 helpline expert, our dementia expert, will be able to, right there at that moment, guide the individual right through that process. And we will do also a follow-up call. So after the helpline specialist talked with the individual for as long as possible, as long as needed, the individual will receive a follow-up call from our chapter to make sure that their questions were addressed, to make sure and to follow up with the steps that were provided by the expert when they called. We do the follow-up, and we also have social workers on staff here at our Long Island chapter that also provide free care consultations. So that was also another step, is for the family to meet with our social worker to discuss their needs. And again, if their doctor, let's say, is not really addressing the concerns in the proper way, you know, they can find other ways to see other specialists to address their concerns.
We actually have to take a quick break. Again, great information. We've been talking with Taryn, Kutujian, and Osman Canales from the Alzheimer's Association, and we will be right back.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence in You on Community Talk Radio, 88.1 FM and WCWP.org. I'm your host, Rebecca Miller, and our co-host, of course, is Otto Los. We've been talking with Taryn Kutujian and Osman Canales, who are with the Alzheimer's Association and really providing a wealth of information. We're so grateful. I mean, it's really great information. That phone number is so important too, because as Otto had mentioned, not every senior is going to be on the computer. So they can call 24/7, and the caregiver or the potential caregiver, because we don't always, when we're first recognizing someone is experiencing symptoms similar to dementia, we may not consider ourselves a caregiver at that point. We're just, a loved one. But calling this number is so incredible because you have all the right information. If you want to, talk to your loved one, you're noticing something, they will help you the right way to address it. You have, you're an incredible network. And that was one other question I had. Do you have referrals? Like, do you have all the best places on Long Island or Nassau or Suffolk, or you were saying you're national, where you kind of have links and recommend people to get checked out?
Yes, we absolutely do. And anyone can call our hotline for any of that information. Once again, that number is 800-272-3900. And it can be things, Rebecca, like you're asking about, what kind of specialist should I see? And if that's the specialist, can you tell me where those are in my area? Everything up to tell me about the latest research and, latest policies, advocacy in New York State regarding to, access for Alzheimer's disease research and funding, and everything in between. Caregivers or potential caregivers, or what some like to call themselves care friends or care partners, can also call and just get resources for themselves. We have a lot of virtual and in-person support groups, and not many people know that. And that's as well as for our programs as well. We have virtual programs. So this is a great resource for caregivers, potential caregivers, family members, or even, somebody who might be thinking about if this is affecting them, because they can on their own time, log on to a webinar or a workshop and get some information and, follow up with us. They can call our hotline based on things that, might have sparked some thoughts in their mind and get more information.
During this whole diagnosis process, a couple of things I have heard that could contribute to the problem or just be the problem. One would be medication, and specifically, and I'm not choosing brands here, but a couple of times I've heard people had Xanax, and Xanax contributes to memory problems. And the other one is that there seems to be a recognition nowadays that if you have a hearing problem, it could make it look like you have some kind of dementia because you don't know what's going on because you can't hear it. So, that's another thing that could be checked out, I think, during the process. Your thoughts on that.
Absolutely. Yeah, Otto, you're 1,000% right. There are many symptoms or things that could be happening, and some of them can be medication related. They can be symptoms or byproducts of medications that the person is taking. They can also be, a byproduct of a different underlying medical condition or something else that's happening in that person, or it could be a sign of stress, financial, strain, other things happening in that person's immediate environment. So I think it's so important, going back to what Osman had said before, really having these conversations with your doctor. And if you're not there yet, getting, that trusted person that you trust, in your family, or that person that you love. And if you're someone who's listening right now who isn't sure who that person is, if you're not sure, who that person is that you would talk to, or maybe you're not sure who that person is that you would trust, the first step I would say in that case is absolutely call our hotline, because you might be sitting here thinking, well, who would I talk to about this if this is bothering me or I'm concerned? And many of us want to talk to people, but maybe we don't want to talk to our sons and daughters or our brothers and sisters or our children or our spouses, because we're maybe admitting to ourselves that maybe there is something that we want to seek out for ourselves. And that's often very scary. So I think part of having those conversations, it's scary to think about it and it's scary to begin that step, but it might identify some of the things that you're saying, Otto, where, you might be, let's say me, I'm going to the doctor, I might be taking a medication and having, let's say, chest pains, but not realizing and not connecting that my chest pains are related to my medication, because that's one piece of all of the things involved in my life and my medical history and my family history and my genetic background, all of the things that we have professionals designed to help us navigate.
One of the things that the goal of Project Independence is to help people stay in their own home as long as they choose to. And I could visualize as things progress with Alzheimer's that you may get to a point where you're going to need help in the house, or you may need to have somebody go somewhere. Does the association get involved with guidance at that point in time as well? Like, what can you do at home? Do you have connections for ways that people can get help at home? And frankly, the next level, maybe it's beyond that. And you do have to go somewhere, really. Where's the association fit there?
Absolutely. Yeah. So the Navigator that we mentioned before, the Alzheimer's Navigator, is a piece of that, where there are some of the things that you've mentioned that can help be incorporated into that plan for further on as the disease progresses. As Osman mentioned before, we know this about Alzheimer's disease and other types of dementia, that it is a progressive disease, so it will change and shift over time. So one of the beautiful things about early detection, and even if it's not early detection, but having conversations with the person with the disease, is giving them that respect and dignity and ownership over all the aspects of the questions that you just asked. What do you want to happen if you become unable to care for yourself? Who do you want in your home? Who are the people that you want around you? Are there any places that you want to visit? Are there any things that we want to set up for you and have in place, either nursing services, home delivery services? The world is very different now. There are lots of things and lots of tools and resources that are available at our disposal. And that person might not be able to, in that moment, deal with and navigate all of those pieces that are so important for them to make sure that they preserve all their dignity and all of the memory and all of the love and respect possible for them at every step of this disease. So that's why it's so important to start having these conversations, to start asking these questions, to utilize our helpline as much as possible, and our website, if it's something that you can access and that's available to you, if you have internet and a computer, because all of the information that we have is designed to help navigate you through each part of this process, not only the emotional part, but also the tangible things like medications, doctors, treatments, appointments, things that you may not be able to provide for yourself or speak on behalf of for yourself at a certain point.
You just said some very magic words. The person's desire, or any of us, our desire to maintain dignity,
Yes.
love, and respect. And I think those are crucial to think about throughout the whole process. And what you pointed out is the person themselves, if they're involved with creating a plan in the beginning, that's really a goal of the plan, is to, you can't put a number on that, but it's a fact of how you are, where you end up in life. Nobody wants to be not have dignity, not have love, and not have respect. And unfortunately, that does happen. People get to a point where they no longer are the person they were. And it's difficult to watch. We have no idea what that person is going through mentally, because they usually can't express what they're thinking.
Otto,
you don't know what's going on up there.
I just had a thought. I think that, I agree with everything you're saying, as always. But, maybe that's something that we need to add to our circle of support. A section on your wishes. Could we have a program called Circle of Support, where it's really it's updated all the time. You can speak with one of our community nurses or social workers. They'll help you do that. And it's really like your plan for life as you age in place, who your connections are, who your contacts, your medications, keep it updated, your doctors, your family, so that you just, you have it close to you. So, that might be a section that we look at, what are your wishes, and I think that might be something interesting.
That's beyond a healthcare proxy and a living will. This is different.
Right.
To me, different.
Yeah. I mean, everyone should be able to make those choices, and maybe it's best to make those choices like a will when you're not at that point,
Absolutely.
I mean, like I'm thinking as you're talking, God, I need like the Grateful Dead and the Rolling Stones always on the radio. When something happens, like that's the person that comes, like I want music around me because, but you want to probably make those when you're, I don't want to say it's not too late, but when you just want to make that as part of your circle of support. So,
and when you're calm, when you can have a clear-headed conversation without, something looming, something urgent right around I mean, we all know we've had to have those conversations when we have to have them, but if you can avoid, or if you can have that space to, like you just said, Rebecca, what kind of music can I keep around? What shows do you want on? What do you enjoy? Because sometimes we make assumptions and we think we know what those things are. Or like Otto mentioned, at a certain point in our lives, we become reduced to our signs and symptoms, and we forget all of the other things that make us people. So I think it's so important for us to continually check in with that, because as caregivers and people around us, we're so focused on meeting needs, but there are a lot of other needs that we can meet as well.
That's not just applies to Alzheimer's. That could apply to anybody who goes through a stroke or any other debilitating kind of a problem. To express that while you can. And nobody really wants to think about that, because a lot of people have a problem addressing subjects like that. And I understand that. I know people that don't want to talk about life insurance. That's their choice, all right? But for those people who are willing to talk about things like that, I think they're better off, and so is their family, or their family is. And I think so is the person. So it doesn't really matter now that we think about it, whether it's Alzheimer's or a stroke or who knows what else can happen. Cancer, people go through some tough stuff.
Yes.
And it'd be nice to be able to, part of your circle of support, maintain your dignity, your love, and your respect during that whole process. Good stuff.
Yeah, really good stuff. I don't even know where to go from here. I'm like, this would have been the best ending, but there are important facts that I think that our listeners might be interested to hear in terms of how many people a day, or how, what's Alzheimer's look like in our country, maybe versus other countries, or, the true age where, we kind of cross over, whatever kind of facts you might have for our listeners today.
I got one other one too, though, by the way. The latest medication that you keep hearing about that costs like $60,000, I don't know the right number, but it costs like $60,000, and you can only take it at a certain point. After you do yours, what's the position of the association on something like that?
So I'm going to address the first question, and then maybe Taryn, or I can add to your question, Otto. For the first question, in terms of the facts, every year the Alzheimer's Association releases a facts and figure report that provides, accurate information in terms of how many families or people are impacted by this disease here in the country. So this year, according to this year's report, there are over 6.2 million Americans currently living with Alzheimer's disease, including 410,000 New Yorkers. So there are 410,000 New Yorkers with Alzheimer's disease. And we know that most are over the age of 65. And aging is the major risk factor for Alzheimer's disease. But we also know that the disease, can develop in an individual under the age of 65. And in the country, there are around 200,000 Americans under the age of 65 with younger onset Alzheimer's disease. So that is the name, younger onset Alzheimer's disease. And interesting enough that the first doctor, Dr. Elias Alzheimer's, who discovered this disease, he discovered this disease or these changes in a woman in her 40s. So again, we usually tend to believe that, the disease only develops in individuals, older individuals over the age of 65, while, most individuals with Alzheimer's are over the age of 65. The disease can develop in individuals under the age of 65. So that is important to know.
Is it in families or is it just random or both?
Yes, that's a great question that we get a lot as well. So the disease can happen to anyone, right? If you have a brain, you are at risk for developing Alzheimer's disease. So science has found two particular genes that are related to Alzheimer's disease. We have the risk genes and the deterministic gene. So if an individual or a family has the risk gene, that increases the risk for developing the disease, but it does not guarantee that that individual will develop the disease. And there is the deterministic gene. So if an individual has the deterministic gene, that does guarantee that they will develop the disease. But it's important to note that this is rare in individuals. There are less than 1% of individuals in the entire world with the deterministic gene. So it is a very, very rare gene and connected to Alzheimer's disease. And to answer your question regarding family history, right? Yes, family history, it is also a risk, right? So the more family members have the disease, the higher the risk for everyone or anyone else to develop the disease. Again, the more the family members with the disease, the higher the risk.
It's funny. It's not funny. Nothing's funny about this, but family history, I have some history with that, not in my family, but another family member, where they have the family history, and it sort of creates a gray cloud of Alzheimer's that never goes away. It's there because they know that they're got a better crack at getting this than somebody without the family history. So I wonder sometimes, are you better off not knowing, or the fact that now puts that cloud up there that you got a shot at getting this problem. It's just a statement, that's all. There's no answer.
Yes, and what we recommend for those individuals looking to get genetic testing, genetic testing is available, but what we recommend is that first visit a genetic counselor that will fully explain the process and will prepare you for that. So definitely you want to speak with a counselor first.
We also have we have genetic counselor information and recommendations on our helpline, the 800-272-3900.
We don't have a lot of time left, but I did want to address Otto's question about the medication, the expense. Is it working? Is there going to be more? What's coming up the pike?
So Otto, if I'm understanding you correctly, I think you're referring to the newest medication that many people have heard a lot about, which is Adjectimab, which is also called Aduhelm. So this is an FDA-approved treatment. And we have heard, there's a lot of conversation and a lot of questions about how much does it cost, who can use it. So many people ask us questions about that. So, I would also say first and foremost, if you're ever wondering, today, right now, tomorrow morning, what's going on with this drug, what's going on in New York State, what's going on Long Island, our helpline has the most up-to-date, accurate information, or even not in New York, if you're looking for another state as well. So if you're looking for that up-to-date right now information, always utilize our helpline, which is 800-272-3900. And then as far as what we're doing in New York State, we're also, the Alzheimer's Association is also involved in advocacy. So we regularly, work with volunteers and staff to advocate at the federal, state, and local levels to increase access for funding, access to stories of individuals with Alzheimer's disease, to showcase the nature of the expenses and the treatments and all the procedures and different things that they have to go to create more of that picture to help legislators understand what this process is like. So there's a lot of information that continues to change around, how much it will cost, other things around it, but we do know that it's FDA approved. We are continuing to be really excited about the implications for its treatment for those with early stage Alzheimer's. And we're excited to see what else will come down the pipeline with all of the research and development that's currently being done as well.
Taryn and Osman, thank you so much. Unfortunately, we are going to break. Great information. We'll have to have you back. I have so many more questions. I'm sure Otto does. It was great to have you on again. Talk of the Town is coming up next, and that will be with Kristina Liu. She's going to catch us up with what's going on in the town of North Hempstead. You're listening to Project Independence in You on 88.1 FM and WCWP.org.